Hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.
Good morning, everybody. Happy Saturday. Welcome to Caribbean and African Health Network Health Hour. My name is Amaka, and I'll be your host today. I'm a specialist pediatric and women's pharmacist, but today I'm hosting this session with our lovely Dr. Michael Sapong. He is a semi-retired dentist, and he's got a real passion for improving oral hygiene and dental outcomes for our Black community. This session is all about empowering us to know exactly what to expect and what to know for our dental checkups so that we'll feel confident when we go to the dentist next time, knowing exactly what to expect and what to ask. So I'm really excited to be here today. Thank you everyone so much for joining from wherever you are. Put in the chat from wherever you're joining from. Dr. Sapong is going to give a brilliant session, and at the end you'll have a chance to ask questions. Any questions you have, you're going to have a chance to put it in the chat on LinkedIn, YouTube, the Zoom chat. I will be monitoring the questions, so make sure you're paying attention and you can ask the questions in the end at the end. So yes, welcome everyone. I'm so excited to have you here today. Please stay tuned and stay focused because this session is going to be a great one. It's going to be super informative and really, really helpful. So Dr. Sapong, thank you so much for joining us today. I'm going to hand it over to you for you to start your presentation.
Thank you very much, Amaka. You're welcome. Thank you very much, everyone, for joining us this morning. Today's talk is about your dental checkup, what to expect, and what to ask. We find a lot of the time that patients do not take as much advantage of the opportunity for checkup and interaction with their dentist as they could do. And so I'm trying today to fill in that gap, and hopefully by the time we leave, we'll all be better empowered and emboldened to take charge of our dental health. I'll try sharing my screen. I've prepared a little presentation, which I hope will, just a minute. Yes. So I hope you can see my screen, and I hope it's all good. Your dental checkup, what to expect and what to ask. My name is Michael Sapong. I'm a dental practitioner from Manchester. Well, based in Manchester. I originally come from Ghana in West Africa. I'm semi-retired, as Amaka just said. For about 20 years, I run a dental practice in Manchester, seeing a wide variety of people and doing some oral surgery at the same time. Okay, so let's get into this. The first and the last thing that I would want everybody to grasp and take away is that prevention is always better and easier than cure. And this is basically the purpose of the whole dental engagement. So your dentist is there to help you prevent dental disease and perhaps manage it if it should ensue, but certainly not as interested in treating dental disease. So a good dentist is always looking at prevention and management. Okay, so why do regular checkups matter? Regular dental checkups are a cornerstone of dental health, and yet they are overlooked and postponed by most people. Most people wait till they feel pain or notice a visible problem before visiting the dentist. But by then, the issue may already be advanced and more difficult and expensive to treat. One of the most important reasons to have regular dental checkups is prevention. Our mouths are constantly being attacked by bacteria, acids, and other things that harm our gums. So within your mouth, it's a seesaw of little ulcers and your body healing them, little ulcers in your body healing them. So you need to keep on top of this to make sure that you're always winning. When you start losing, that's when dental disease steps in, and that's where it can be detrimental to your health. So, for example, dental plaque will build up over time, and if it's not removed, it calcifies into tartar, and tartar cannot be removed by brushing and flossing alone. So you need professional cleaning to help with your plaque and tartar control. Another critical benefit of dental checkups is early detection of problems. So a lot of dental problems are silent. So as a patient, as an individual, you may not be aware of what's going on in your mouth until a qualified professional can examine you and point out to you. It's worth bearing in mind, and I think we had a talk about this once, that your overall health and well-being can be linked to your dental health. So while your especially gum health, while your dental health, if it's not up to scratch, top notch, can introduce toxins and bacteria into your bloodstream, which can cause problems elsewhere. The appearance of your mouth also can be a signal of what's going on in other parts of your body. So it's a two-way situation. But generally, when you have good dental health, then we can by and large discount the part of your general health that is contributed to from your mouth. Dental visits also provide the opportunity for education and personalized advice. So we're all different people. We all have different mouths, different oral environments. And what your dentist sees in your mouth when you attend for your dental checkup will influence the personalized advice that they can give you for improving and maintaining your own oral condition. Now, a lot of people are anxious and scared about going to the dentist. So regular checkups also help build a relationship of trust with your dentist, which can take away a lot of the anxiety. So take away a lot of the anxiety, improve communication, and foster confidence in managing your oral health. In summary, dental checkups are far more than just routine visits. They protect your smile, save you from pain and expense, support your whole body health, and provide the knowledge and confidence you need to care for yourself. Like I said, prevention is always better and easier than cure. So, in summary, yes, early detection prevents bigger problems. So let's bear that in mind. Attend your dentist regularly and things will be detected earlier. Oral health is linked to your overall health. So the main ones, things like heart disease, diabetes, changes in pregnancy, um, also important to bear in mind. And most problems are painless until they're advanced. So we've seen people who have come to see us at a stage where the teeth are so loose that there's nothing you can do with it. And in some of these cases, generally, it's not a problem to do with the teeth, it's a problem to do with a systemic condition which has not been diagnosed. Okay. Now, common oral health challenges. Now, what makes people um, want to go to the dentist, and what are the common things that are diagnosed at the dentist? Tooth decay and cavities. So it's the low-hanging fruit. Excess sugar, which is not removed regularly, will lead to decalcification of your enamel, and then bacteria get seeded into it. You get dental decay, goes into the dentine, the pulp, and before you know it, the tooth needs to be removed. So if tooth decay is picked up early, then you are guarded. Yes, you're protected against the eventuality of tooth loss. Gum disease. Now, the one thing that I would like to stress, really stress, is that gum disease is perhaps the thing that we should all pay the most attention to. The gums, well, the gums are the parts that you can see, but the gums in the jawbone together will hold your teeth in your jaw. Now, if your gums are not healthy enough, the teeth are going to suffer. The teeth are going to get loose in your jaw and they're going to need to be removed and all of that. Also, if the gums are not healthy enough, the gums themselves can form a pathway for the introduction of bacteria and other toxins into the rest of your body. So gum disease, very, very important. Oral cancer. Now, I think it's perhaps your dentist who is best placed in the recognition and diagnosis of oral cancer. Bottom line, if you have an ulcer in your mouth anywhere, which is not healing after 2 weeks, an ulcer that lasts more than 2 weeks, by all means, go see your dentist. It may be nothing, but if it's oral cancer, this is the most likely presentation. There are other presentations of oral cancer like white patches, red patches, and so on and so forth. But if you attend your dentist regularly for checkups, oral cancer can be picked up early and it could save your life. Now, I put in here impact of diabetes and high sugar diets. High sugar diets, that's has a direct relationship with dental decay. Also has a direct relationship with the ability, if you remember before, I said that your gums are always coming under attack from cuts and infections and so on and so forth. But if you have a lot of sugar in your diet, goes into high blood sugar, that restricts your innate ability to fight these infections. So you're more likely to have gum disease if you've got persistent high blood sugar. Now I just put diabetes there, but it's also the impact of a lot of other systemic diseases like heart disease, hypertension, and so on and so forth. So let's bear this in mind. Okay. Now it's important to talk through what happens or what is supposed to happen when you attend for a checkup. These days, by and large, you find that People who have dental checkups, they're in and out 5 minutes and that's it. Yes, sometimes that actually satisfies the purpose of the checkup. But from the patient's point of view, and it is my responsibility today to tell you what is supposed to happen, and let's just walk through that. So, dental checkups really matter. They help prevent problems, detect issues early, promote oral health, and empower patients with knowledge. A checkup is more than just looking into your mouth or looking at your teeth. A typical checkup has several components. It starts with a conversation about your health and concerns, a thorough examination, possible diagnostic tests like x-ray examinations, um, treatment planning, and treatment planning will generally include cleaning and a discussion of costs, options, and your rights as a patient. So your checkup starts even before you sit in the chair. A dentist or nurse will ask about your medical and dental history. They may review existing records or forms that you completed and ask questions about medications that you take, allergies, medical conditions elsewhere in your body, diabetes, heart disease. Yeah, I mentioned medications. Medications very important these days because lot more and more people are taking medications, and more medications have impacts on your oral environment. So medications that you take and any treatment or hospital stays that you may have experienced recently. There's a whole long list that they go through, but this is just a précis. This is just a little summary. This actually is the time for you to mention any concerns that you may have and actually to go to state the reason why you've attended the dental visit. The reason you need to do this is because it will set the tone for the rest of the engagement. Very often we find dentists operate appointment lists. So you find at the end of 20 minutes, that is when the patient says, "Oh, and by the way, doctor, my daughter is getting married, so I was wondering about changing my front fillings to white fillings and having some veneers." And at that stage, the appointment is gone. So please, if you have any problems, this is the time to mention it before the examination, the physical examination starts. Then there's the physical examination. So the dentist will carry out a visual and tactile examination, and they will check your teeth for cavities, cracks, wear or loose fillings, among others. They will check your gums. Now, gums. This is the message I want to leave. For signs of inflammation, bleeding, recession, infection. We check the other soft tissues of your mouth. So your palate, your tongue, cheeks, your throat. And as they do this, they will also screen you for oral cancer, because oral cancer is a soft tissue, well, a generally soft tissue a problem, and that can be picked up by visual examination. They'll also check how your teeth bite together. They'll look at your jaws, and they'll assess for alignment, any grinding and problems like that. As part of this, they also make a check of your breath and your salivary flow. It's not so much checking it, but it's a visual inspection. Yes, as these can indicate underlying issues. In some cases, following the physical check, the dentist may be prompted to use other diagnostic aids like x-ray pictures. Sometimes there's special lights they can shine between your teeth to pick up decay and things like that. So based on your history and complaint taking and your physical check, examination, and the special tests, which are usually X-ray pictures, a treatment plan will be formulated. A treatment plan will generally include some elements, include a consideration of how well your teeth are cleaned. And generally, most people will need a little bit of help with professional cleaning. With the treatment plan, you will learn about any problems detected, their severity, and potential consequences if left untreated. Now, this is very important. You need to understand what the problem is, you need to understand the severity of the problem, and you need to also understand the consequences if you leave it alone. A dentist will explain treatment options available, their benefits, risks, and expected outcomes. Where more extensive care is needed, the dentist may show you images, or they might use other like study models and things like that to help you understand properly. Sometimes even some dentists will give you an online link so you can go and read about this yourself. Now, at the treatment plan stage, this is the time also to discuss your goals. So what you need to do, what treatment you need should always be married to the results that you want to get personally at the end. So whether it's about improving your smile cosmetically or addressing other specific needs like chewing, eating, speaking, you find maybe you're lisping and you don't want to lisp, your dentist can help you prioritize and create a plan that fits your needs and circumstances. So it's important that you engage with the dentist at the treatment planning stage, because that is when whatever is going to happen to you in terms of treatment is decided. Now, a good dentist will also be transparent about fees. They will explain the fees for proposed treatments and provide a written estimate. It used to be that the written estimate was provided on request, but more and more with the improvements in quality, dentists are now actually providing written estimates without you asking for them. They will discuss your options for treatment on the NHS or outside the NHS. You have a right to ask questions about alternate treatments, the pros and cons of these alternative treatments, and whether it's safe to decline or delay a procedure. Eventually, the final decision is yours. No treatment should ever be carried out without your informed consent. So you must know what is going to happen before it happens. Now, when we put it this way, we're talking more about the treatments themselves than things like checking with the probe and things like local anesthetics and so on and so forth. You must have a certain acceptance of what is going to happen, but it is not the case that the dentist will tell you, well, I'm now going to stick the probe here to check this, and I'm going to do this, and I'm going to do that. Some of these, to a certain extent, some of these procedures are accepted as implied consent. Now, remember also, very important here, that you have a right to clear information, respect, and time to make decisions about your care. You should not be rushed, and you should not feel rushed about making decisions regarding your care and treatment planning. So if we go to summarize this, your examination or your checkup will start with a discussion of your history and whatever concerns you may have. There'll be an examination of your teeth, gums, and soft tissues, x-rays or special tests if needed, some element of cleaning and polishing if needed, advice and treatment plan. But this is basically what goes into your treatment planning before fees and options and things like that are discussed. Okay. So I have said a few times that you need to engage your dentist and you need to ask questions. Here's a short section on what to ask your dentist. Okay. You ask your dentist the appropriate questions, but within this consideration of appropriateness, then basically you need to ask about your oral health. So you need to ask if you've got signs of cavities, gum disease, other issues. Are your gums healthy? If they bleed when you brush, you need to find out why. Are the fillings and crowns and dentures you have still in good condition? Do they need changing? Do you need x-rays or other tests? You need to ask about prevention. So how you should always be looking at improving your brushing or flossing, your home care. So how can you improve that? You need to ask about fluoride if you're not sure. If there are any areas in your mouth where you're missing when cleaning, you could ask the dentist to point that out to you. Are there any foods or habits that you should either take up or avoid in terms of improving your dental health, in terms of preventing dental disease? Of course, always ask about treatment options and costs, and ask how your overall health is being impacted by your dental health or vice versa. These types of questions are always welcome to your dentist. They show that you're engaged and care about your health. A good dentist will take time to explain in clear language and make sure that you understand. Sometimes when they can't answer your questions properly, some dentists will actually take the time to go look things up, give you a call, or pass it on to somebody else who can explain better. So yes, what to ask your dentist. So again, in summary, ask about gum disease or decay. Today, I want everybody to focus on gum disease, gum disease, gum disease, gum disease, because that is that part of your mouth which has got systemic relations, systemic connotations. You want to improve your oral care. So how can you improve your brushing or flossing? Do you need further special tests, or do you need sometimes, again, even though we all use fluoride, well, most people use fluoride in their toothpaste, some people don't, and it's a matter of choice. There are some people who need stronger fluoride toothpaste, and you need to check with your dentist if your oral condition warrants something like that. Always check that your fillings and crowns are okay. Same way, well, fillings, crowns, they can fail. Everything's got a lifespan. So you should never assume that because you got a filling somewhere, it's going to be in place forever and ever. Sometimes they need changing. Oral cancer. Now that again is something that should always be at the back of your mind. And it's not just oral cancer that can be picked up in your mouth. So any other systemic diseases that your dentist can pick up, it's always to your benefit. Okay. What not to ask your dentist? Now, I put this in from personal experience, not because I think that some patients can be a nuisance, and sometimes they are, but because I want us all to be focused on the opportunity for the visit and to be focused on getting the best out of the visit. So, first of all, avoid asking questions that are irrelevant to dental care or unprofessional, such as personal questions about the dentist's private life, their relationships, income, political views, things like that, sports. There is a small window in all of this for social type conversations, but you want to keep it to a minimum. You also want to avoid making requests for medical advice that is outside the dentist's expertise or competence. So people come in and they sit down and say, "Oh, let me show you. I had a knee replacement about 3 months ago, but I think the scar is not healing very well. Can you look at it for me?" That is not why your dentist is there. And to be honest as well, your dentist may not be able to tell you much about your scar and whether it's healing well or not. All you're doing in this instance is just spending your time inappropriately. Secondly, don't ask your dentist to do anything unethical or unsafe. So sometimes patients will come in and they say, "Well, my insurance wants me to have my teeth cleaned twice a year, but I really, really don't like cleaning. So can we just write down that we've cleaned it and sign it off?" You don't want to ask things like that of your dentist. Sometimes, again, people ask a dentist to ignore what is obviously a serious problem because they don't want to deal with it. They're not ready to deal with it, and all of that. Um, you're better off telling the dentist that you don't want to do this and getting the dentist to put it in your notes as a record. The big one is antibiotics. Sometimes people walk into clinic and they come and the first thing they sit down is, "I want antibiotics." It doesn't really work that way. Antibiotics have to be prescribed based on prescribing criteria. And you find that patients come and it can be a bit of a long battle trying to convince these patients that they don't really need antibiotics, or even trying to convince them that before you prescribe antibiotics, they need to go through a process of assessment and diagnosis. And also, they need to go through a process. So please don't ask your dentist to do anything unethical or unsafe for you. And lastly, avoid asking your dentist to provide free or discounted treatments inappropriately. It kind of debases the whole professionalism of the engagement, and you find that it very, very soon becomes an embarrassing conversation. There are certain practices where there's the facilities for people who cannot afford so much to have a discount here and there. But if you're going to ask for that, then please make sure that you're doing it in a respectful manner. So your dentist is there to help you. Asking questions about your health, care, and choices is your right, and good dentists will always welcome it. At the same time, it's important to respect the professionalism and focus on what serves your health and well-being. Again, if we summarize this, yes, respect in summary, respect the professional boundaries both of the dentist and of the environment. So stay out of the dentist's private life and personal views. Do not request for medical advice outside their expertise. Don't encourage unethical or unsafe conduct. Eventually, it comes to harm you as the individual. And don't ask them to provide free or discounted care inappropriately. So at this stage, we've gone through, you've gone for your checkup, you've had your checkup, you've discussed your treatment options, you've had the opportunity to ask questions, and all of that. Now, I always think this is quite important, that you have to recognize that you've got certain rights. Okay, so during your checkup and beyond, you have certain important rights as a dental patient. You have a right to receive care in a safe and clean environment. You have a right to be treated with dignity and without discrimination. You have a right to have all findings and treatments explained clearly in a way that you understand. And you have a right to see and get copies of your dental records. You also have a right to refuse treatment or request a second opinion. You bear that in mind. You have a right to refuse treatment. We normally say decline treatment. Refuse can be a bit of a strong word, but you have a right to refuse treatment. And you have a right to complain or provide feedback if you're unhappy with your care. You also have a right, in this same vein, to give good feedback if you are happy with your care. So these days, thanks to Google, most practices ask you for Google reviews and all of that. Please, please, please give reviews when you can, because it tells the practice the truth about what they're doing, and it also gives them a sense of reward for all the hard work that they've put in just to receive and look after you. I mean, I ran a dental practice for many years, so I've got first-hand experience of the kind of work that it takes to run a dental practice properly, spending weekends and doing all sorts of research, attending courses that are not anything to do with dentistry, just so that you can make sure that your patients have a good experience. Okay. So by understanding what happens at a dental checkup, you can approach it with confidence and take full advantage of the opportunity. Arrive prepared with a list of questions or concerns. Be honest about habits like smoking or sugar intake. Your dentist is there to help you, not to criticize. So, yeah, people come in, the chap sits in the chair, he's smelling of cigarette smoke. Do you smoke? No. And you think, well, from a professional point of view, you just have to carry on. But that kind of attitude sours the relationship, because then it kind of interferes with the trust between patient and dentist. If you have a treatment plan drawn up, please follow up on the treatment plans and keep your appointments as scheduled. Because again, treatment plan is all in your interest. So if you don't do this, you're just making things worse for yourself. Okay. Now, I thought I would also mention common myths and facts, because these influence the mindset with which people attend the dentist in the first place. And if you are not aware of your awareness of dentistry and the facts around dentistry will influence the positions that you take and the choices that you make. So we'll just run through a few of them and then summarize. So the first one, people will say that if it doesn't hurt, it's fine. That's not true. A lot of dental problems are very silent. They're very painless in their early stages, and they only start hurting when things have become critical. Some people will say, well, brushing harder cleans your teeth better. That is not true again, because the parts of your teeth that you cannot clean are the same whether you use a soft toothbrush or use a hard toothbrush. So it doesn't matter how hard you brush, there will still be parts of your teeth that you're not cleaning well. Again, if you brush harder, you're actually damaging your tooth structure in an almost irreparable fashion. So I've always made this analogy that you think about your teeth like your kitchen work surface. You wouldn't take a bristle brush to scrub your kitchen work surface because you're afraid that it gets scratched and it loses its shine and all of that. And it's, well, then it gets rough and then it starts to collect bacteria and mold and all sorts. Same with your teeth. You want to clean your teeth, but you want to clean your teeth with brushes that are as soft as is necessary to achieve the cleaning. No matter how hard your brush, it is always going to remove some of your tooth substance. So you're better off choosing a soft toothbrush, doing your best with it, and then seeing your dentist for a checkup regularly, so that your dentist can pick up where you've not been successful. Some people say bleeding gums are normal, and my gums are bleeding because I've brushed my teeth a bit too hard. That's not true as well. Okay, your gums will bleed because your gums have become spongy, and your gums become spongy because of plaque and tartar accumulation. Generally, that is the cause for bleeding. And in that case, the plaque and tartar needs to be removed so that your gums can recover their health. Some people will say professional cleaning damages your teeth. Again, that's not true. Professional cleaning actually removes the plaque and tartar that your normal toothbrushing practices cannot remove. And people will say when they've had their teeth cleaned, they feel like they've got gaps in between their teeth, and they don't want that. They want their teeth to be smooth, the back of the teeth to be smooth to the tongue. Okay, fair enough. But the back of the teeth is smooth to the tongue because the spaces between your teeth have been filled in by plaque and tartar. Now that plaque and tartar, once it's removed, then allows you to feel your teeth separately. And that indeed is what it should be. Let's bit about whitening. I'll leave this about whitening. There's dental treatment is always painful. Dental treatment is not always painful. Modern dental care is far more comfortable than in the past. And with improved techniques, local anesthetics, and patient-friendly equipment, it's becoming more and more comfortable. And also the thing to bear in mind is that the more comfortable you are with your dentist, the less uncomfortable the treatment is. So if you have somebody you've seen over and over again and you've developed confidence with the person, you find that the treatments are not as uncomfortable as they would otherwise have been. Okay, so let's summarize that too. Yes, first one, if it doesn't hurt, it's fine.
Sorry, Dr. Sapong, sorry to
Yes.
interrupt you. We'll have a lot of questions in the Q&A session. So please could we do that shortly? Thank you.
Okay, all right. I think, okay, let me just go through this. I thought this was going to happen today because we went, okay, myths about NHS and treatment. Okay, we can do that in the Q&A section. And finally, these days you go to a dental practice and there'll be a dentist, there'll be a therapist, and there'll be a hygienist. It's very, very important that you are able to distinguish between them, what they can do for you and what they cannot do for you. So therapists typically will be able to do a scale and polish. They'll be able to give you oral hygiene and diet advice. They can do some fillings. They can extract baby teeth and they can take x-rays. Hygienists will be restricted to scale and polish and to give you advice. Dentists can do most things, well, everything that is available from the dental practice. Right, key takeaways. This is what I want you to take away. Visit your dentist regularly. Prevention is best and cheapest. Know what to expect and what to ask. I think we've covered that in detail. A healthy mouth goes hand in hand with a healthy body. So get your mouth as healthy as you can. And your dentist is your partner in care. Your dental care journey is a lifelong journey, and your dentist is your partner in that. Okay, so time for questions and discussions. I have prepared an information sheet which includes the top 10 questions to ask your dentist. So that is available on the CAN website. You can contact me at michaelsapong@nhs.net, and that's my phone number as well. You may want to put it down. I make myself available to speak to anybody who wants to speak to me. Thank you very much, and I'm sorry we overran a little.
No, thank you so much, Dr. Sapong. That was such a good presentation, so informative. I definitely learned something, and I'm sure others did too. We have quite a few questions, and we've only got about 10 minutes, so I'm going to run through them as quickly as possible, and if we can try and keep it quite concise. So I'll just start with the first one from Anne from YouTube. Is there a regulatory body to monitor dentists who offer unnecessary procedures just to get money? Is there anything like that?
It's called the General Dental Council, and
Yeah.
you can find them online and contact them. But the first port of call, especially if you want to improve your case, is to go through the practices complaints procedure. Next question.
So is it true that bad dental health can cause some cardiovascular issues? So potentially, because I'm aware of like endocarditis that is often linked to dental hygiene, but is there any other cardiovascular issues that are caused by bad dental hygiene?
Yes, to the extent that your gums allow the infiltration of your bloodstream by toxins and bacteria, then yes. There's a whole plethora of conditions that can be caused by bad oral hygiene. Short answer is yes.
Okay. Next question. Is it true that children end up having to be hospitalized for tooth extractions? Is that something that you see regularly, or is it like patient specific, like if they need to be under general anesthetic or?
The short answer is yes. In some parts of the UK, the dental, but okay, let me put it this way. I think, don't quote me, but I think something like 5% of all general anesthetic and admissions in this country are for the removal of children's teeth.
Okay. Right. Okay, thank you for that. Next question, because I know you said in your presentation to focus on gum disease, but what actually causes gum disease and what are the signs and symptoms that we should be aware of?
Okay, again, very quickly.
Yeah.
Your saliva traps bits from the food that you eat, and it settles as plaque on your teeth. Plaque is soft. If you leave plaque there without removing it, plaque hardens, it calcifies. When it calcifies, it settles on the tooth gum junction, and the gums at that um, junction become inflamed because of the toxins and bacteria trapped in the plaque. So that's how it starts. What was your question again?
It was like the signs and symptoms of gum.
Signs and symptoms, right? Signs
Yeah.
and symptoms are the signs and symptoms of acute inflammation. So pain, swelling, um, bleeding. Yeah, so basically pain, swelling, and bleeding. So
Okay.
when your gums start to bleed, that's the first proper sign.
Okay. Okay, thank you for that, Dr. Spong. Oluwasola, I can see you put your hand up. I'll get to you in a second. A question that kept cropping up in the comments was about affording these checkups. So someone asked, it's quite difficult to register with NHS dentists, but if I can't afford private fees or you can't afford dental checkups, are there payment options available, or is it a case of just having to save up?
Yes, that was the one of the things I was going to speak about.
Yeah.
Um, these days, more and more practices are offering private payment plans. They will always be more expensive than NHS treatment, but a lot of them are becoming more and more affordable. So check with your local practice and see what's available. But they are available, yes.
Okay, thank you. How, this is another question. How do I know if my dentist is experienced with working with darker gums, or is that something all dentists should be trained in, like different kind of gums?
Uh,
Or are all gums kind of just like the same-ish?
yes, I'm trying to find the right word, but that is not a consideration.
Okay,
Gums are gums. Um, so that is not a consideration. No.
okay. Oluwasola's got her hand up. Can someone unmute her so she can ask the question? Or him, sorry. Um, Olu-
Hello, can you hear me?
yeah, yeah.
Right. So, good morning, Dr. Sapong. I think my question is very similar to what one of the questions that you read out previously. So, I've been to a dentist quite a few times, and they've mentioned that I needed some fillings, and I really want my fillings to be white fillings,
Mm.
but they're offering me the other one, amalgam. I think
Amalgam, yes.
it's the silver one, yeah. And whenever they want to offer me the white one, they're always giving it to me like on a private plan. And
Yeah.
I know that you can get it on the NHS sometimes as well, but it seems to me that they're encouraging me to get the silver one. And I've heard that there's like some level of is it magnesium or something that is involved in the silver one. But even regardless of that, I want my fillings to be white, but it seems they're just offering it to me on private. Is there a way I can sort of like perhaps get it on the NHS plan because it's a lot more cheaper?
Okay, yes, it's a shame we don't have much time. But basically, the NHS remit is to provide treatment that is necessary to secure and maintain your oral health. The silver filling, the amalgam filling, satisfies that remit. And you find that because of NHS funding, which is not great, most practices will go for whatever filling does the job, full stop. So, unfortunately, if you want a white filling, then you will probably have to go along with your dentist's prescription and pay for it privately. Having said that, um, the NHS, they make this bold statement, but they keep um, modifying it from time to time. So at the moment, fillings from your canine to your canine, top and bottom, have to be white, but anything behind can be silver. I hope that answers your question.
Okay, thank you so much for that, Dr. Sapong. We've got the final two questions here. Someone has asked, are certain dental procedures dangerous if they're pregnant?
Pregnancy is
Yeah.
Is a time of physiological change, and also the whole purpose of avoiding treatment when you're pregnant is to avoid any sort of shock or trauma to the baby. So we tend, if we have to do something, to limit treatment to the middle trimester, so month 4 to month 6. But having said that, then we do we make every effort to avoid doing the treatment in the first place and wait till babies arrived. Having said all of that, your pregnancy does not make any treatment more dangerous to you as a mother than it otherwise would have been.
Okay, thank you so much for that, Dr. Sapong. Okay, I'm going to take the final. Well, this one's not that really much of a question, but someone has put on the chat that Liverpool, London, and Manchester have university dental hospitals. Fourth and fifth year dental students are quite experienced and they need practical experience, but it's supervised and they often welcome patients free of charge. So someone's put it in a chat. I think Sam will expand on it more. If anyone is looking to get any dental procedures, there are dental students that will happily take them on. But yeah, I'm going to hand it over to Stephanie now. Sorry, we've overrun a little bit, but Dr. Sapong, thank you so much for your time. If anyone has any more questions, I think they can kind of still put it on a chat, and maybe we can compile them and get answers to that later on. But thank you everyone so much for tuning in. I hope you've learned something. I definitely have. Dr. Sapong has put like an advice sheet that we will circulate. It's on the chat as well, so that you can have like a tip sheet the next time you're going, or the key things that you need to know for your next dental checkup. But yeah, thank you so much. If you've got any more questions, email the Khan email that's on the chat. But yes, thank you so much, everyone. Over to you, Stephanie.
Thank you so much, Amaka and Dr. Sapong. Thank you for hosting, Amaka, and thank you, Sapong, for the vivid presentation on dental care. It's really important, and I know a lot of questions will still come up because we all are affected by these dental issues in the UK, and we know how it's not cheap and everyone wants to have it. So thank you so much for giving up your time today and talking to us more about it. So our next health hour is going to be on the 28th of July. It's the same time, 11 to 12 a.m. So next week, Saturday, would be about Let's Talk Fibroid. Your voice matters, your story heals. So please come and join us for a very brilliant presentation from our host is going to be Dr. Vanessa Appiah, and we're going to have a panelists, who is Dr. Azima Okoji, Dr. Julie Hammond, and Dr. Patrice Alto. So if you have more information, if you want more information, you can also scan the QR code on my screen, or you can also email info@can.org.uk. And so all party parliamentary APPG on Black Health, we are calling for evidence on reproductive equity and fibro crisis. So we launched our APPG on Black Health recently, and we had our inaugural meeting on fibroid health, and there was a lot of call for evidence. So please try and scan the QR code, because we know a lot of our Black women are affected by fibroid and your voice matters. So if you want more information, please email, you can email inquiries@appgblackhealth.uk, or you can also email the canteen and they will respond to you. Please, we need as many voices about fibroid health as much as you can. Please circulate this to your network and to your friends. It's really, really important for us to hear from you about what you have to say. So also, we're going to have our Greater Manchester Black History Month. So it's taking place on the 25th of September. This event officially launches a celebration of Black History Month in the city of Greater Manchester, and it's also delivered by CAN and supported by Greater Manchester Combined Authority. These are pictures from our previous event. You can see how elaborate and glamorous it was. Please, we want you to be part of this event this year. Please try and come and also support what CAN is doing and have a very lovely night. You can see a lot of beautiful, faces and people having fun. We want you to be part of that, and also circulate this to your network as well. Because if you don't know who will need this information, and it will be good to always come together as a Black community. So our Black History Month Gala, which is to honor Black champions, is also taking place on the 11th of October from 8:30 till late. It's also a black tie event. It's going to take place at Concord Conference Center, the Runway Visitors Park, Sunback Lane in Altrincham. So similar to our Black Healthcare Award that we had last week, it's going to be beautiful. So please be part of it. Scan the QR code on the screen and also circulate with your network as well. You can also email the event team at CAN. That's events@can.org.uk if you want to be part of this event. It's going to be interesting. Please, you can't miss this event. Please, there are drinks, there's performance, there's 3-course meal, there's talent spotlight, there's community and organizations award. Please, we are also opening nominations for opening up nominations. Please nominate people so we can also appreciate them for the work they are doing. And please email us so we can tell you more about it, because this is a short time for us to explain more about the Black History Month Gala, but it's a place you don't want to miss. So please be part of our Black History Month this year. So as an organization, we are constantly looking for volunteers to support the work we do. So if you're a nurse and midwife looking to give back and grow and create a real impact in the community that looks like you and you represent, please, you can also scan the QR code online. This is what we've done so far. We've offered 200 free health screenings. We've supported 100 women for perinatal and infant mental health. We referred 20 women for counseling. We know how important counseling it is in our community. So why you should volunteer with us is because you can help reduce health inequalities, which is what SCAN stands for. You can also connect with people with vital health care services, and you can also access training, network opportunity, and collaborate with specialists as well. You can work alongside like-minded professionals making a real difference in our community. So please be part of our volunteer team, and you can scan the QR code or you can email scholar@can.org.uk to be part of our volunteer. So you can volunteer either in London or Manchester, because we always, look for volunteers to support the work we do, both in the community and also at our event. So thank you again for joining us today, and we hope to see you all next week. Please tune in next week, and when you're coming next week, ensure you come with one person. Invite one person to join you, because it's always beneficial to get one person to benefit from health topics like this. So thank you, and I look forward to seeing you next week. Bye. I'll hand over back to Sam. Can everyone hear me all right?
Yeah, thank you very much, Stephanie.
Thank you. See you. Have a great weekend, everyone.
Bye-bye.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community.